Now, your health, your safety. This is ABC7 News.
Hi everyone, I'm Liz Kortz in for Kristen Z today. Every day at 3 we will be on air, and all of our live stream platforms will have a daily expert come in that you can ask questions to in real time. Today we have Dr. Susan Phillips. She's a director in San Francisco's Department of Public Health, joining us via Zoom. So you can post your questions on our Facebook live stream right now on our YouTube live, or check out our Instagram stories to submit a question, or on my own Facebook page, Liz Kortz News. We're taking all your questions and asking the experts, and the show always continues online. We do take commercial breaks here if you're watching us on TV. So let's get right to it. Joining me live is San Francisco Deputy Health Officer Dr. Susan Phillips. Thanks for joining us, Dr. Phillip. I appreciate it. Let's just start big picture. 4 weeks in, we're beginning our 4th week now in this shelter in place. How do you think San Francisco, the Bay Area, is doing and stacking up compared to other areas?
Well, I think that you're right. We have been sheltering in place now for quite a long time compared to the rest of the country. And I think it's really great that the Bay Area has been a leader in that, and California has also been a leader around the nation. So as to the answer about how we are doing, I think we are cautiously optimistic, but we are not ready to declare a victory yet. We know that the part that everyone has been playing in staying home is incredibly important. And we are also looking at the data. And we feel that, we need to continue to look at the data. It's too early to say that this has completely been taken care of and that we have accomplished everything that we want to do with the shelter in place, which, again, to remind everyone, is to try to decrease the speed at which people are getting infections with COVID-19, primarily so that we don't have a lot of people becoming very ill at once and overwhelming our hospital system. So we're measuring the number of hospitalizations, we're measuring the number of cases, and we know that those cases will continue to go up, because one of the challenges that I'm sure people have heard about is that testing is very challenging and getting enough tests in place. So as we test more, we'll see more cases, but we're going to keep monitoring how our hospitals are doing, how our capacity is doing. And so far in the Bay Area, we have been able to take care of patients as they've come in, which is a good sign, and which really shows that we need people to continue the good work they've been doing with sheltering in place and following the other recommendations we have had.
Absolutely, and we're going to take some of our questions that we're getting submitted to us right now. Here's a question from Instagram. What are the chances that the stay-at-home orders get extended?
So they have been extended once already. They're now extended through the end of this month. And we know that it's really challenging for people. So these are things that have to be balanced. The difficulty and the disruption to individual people's lives. And because we don't have a vaccine yet, because we're still trying to find effective treatments, we know that the shelter in place is the most effective tool that we have. So I don't have a complete yes or no answer about that. What I can say is that we are weighing the data every single day. We know that there's a great cost to sheltering in place in terms of people's lives. And we also know that we want to prevent the kind of real heartache and devastation that we've seen in the healthcare system and in the lives of people in other countries and in other cities here in the United States, like in New York City. So it's a challenging question. We're evaluating it every single day.
When you talk about New York City, there was a point when the Bay Area and New York pretty much had comparable number of cases, and now we've seen a huge spike in New York. Do you foresee, if we continue doing what we're doing here in the Bay Area, that we could get to that point in New York, or are we kind of, are we past that point at this point?
Well, I think, again, we will see more cases in the Bay Area, and we are increasing our testing capacity every single day and every single week. So we want more people to have access to tests. We know that that's been really challenging. And we especially want the people who are most at risk for serious complications of COVID-19 to be able to get tests. And so that is our goal, to increase testing. As we increase testing, we're going to see more cases. But again, I think it's not necessarily just the number of cases, it's that curve, as you alluded to. How are we doing in that? How steep is that rise in the number of cases, and how quickly is that happening? The other thing that's going to be really important is looking at hospitalizations. And Director Grant Colfax of the Department of Health and the mayor have announced that we're going to have new data that's going to be up in the department website, where people can look to see our testing numbers. So that'll help us all understand how we're doing in relation to New York and how we're doing over time, just compared to ourselves.
Right. I want to ask another question now from Instagram. Someone asked us, do you have any updates on how the virus spreads?
So we know that the virus spreads through respiratory droplets, so primarily through just coming out of our nose and mouth. What's become increasingly apparent and what experts have learned over the last several weeks is really how much it may be true that we could be asymptomatic or have very, very low level symptoms and still transmit virus to other people. So that was really the impetus for our recommendation last week, at the end of last week, that all of us actually cover our nose and our mouth when we go out. And it can be with a scarf. It can be with a piece of cloth, a bandana. It doesn't have to be a mask. And in fact, we would like to leave masks for the health professionals. If you are using a mask, make sure to use it as long as possible. The goal with that masking or covering our face is really just to try and decrease the amount of virus that we might transmit to others without intending to, without feeling sick at all. And if we are all doing that, then we all have some measure of protection. It's yet another layer of ways in which we can try and disrupt the transmission cycles in the Bay Area.
You know, we've seen other counties in the state, as we talk about masks, require masks and make it a requirement if you go outside to wear something covering your nose and your mouth. Do you foresee San Francisco making this an actual requirement for people?
We again are always weighing new data and new evidence, and we're weighing it against sort of how we are doing with our number of cases. So at this point, we are not going to be making it a requirement, but we always want to continue looking at our numbers, looking at feedback that we're getting and seeing the experience of other counties in California that might be doing that. We might make an adjustment in the future, but for now, it is just a strong recommendation that everyone do this.
All right, Dr. Phillips, stick with us. We're taking a break on air, but if you're streaming with us right now, the show never stops here, so we'll keep the questions going online. You can join the conversation, like we said, on our Facebook Live, our ABC7news.com website, or on our app. So we'll take a quick break, but we'll keep the conversation going here.
And we're in commercial break.
All right, Dr. Phillips, let's keep this going. We're getting a lot of questions coming in on our Facebook page, so I'll actually go and ask one from Facebook. Someone says, is it true that they have a vaccine for it already, one that is used for malaria? So I assume this person's referring to the hydrochloroquine that we're talking about. What are your thoughts on that?
Yes, so that is hydroxychloroquine. It is a medication that is used for certain conditions, including lupus. And it is a medication that has been shown in some trials to have some benefit, but they've been very small. And these have not it has not proven benefit in very large, what we call controlled trials. So it is not recommended that people take this or prescribe this to patients if you're a medical provider at the moment. There are some serious side effects that can be caused by this medication, and people have died by taking too high of a dose. So we don't have enough knowledge yet to say that people should be taking this regularly outside of clinical trials where they're very controlled conditions.
All right, thank you. And another question I saw that we got from Instagram, as we go back to talking about how this can spread through respiratory droplets, someone asked us, what if I see a homeless person on the street coughing? Is there something I can do? Is there a way I can help them? What are your thoughts on that?
Yes, that's a really great question. And you know, our neighbors that are unhoused and unsheltered are a big priority for the Department of Public Health to ensure that they have the services that they need and that they can stay healthy. And so there are large groups in our city departments, in our emergency operations center, that are working on making sure that people can have access to masks, to places that they can wash their hands. And we're working as well with the mayor's office and
Dr. Phillips, I'm going to interrupt you for a second because we're about to come back from our commercial break. Stick with us. Hold on. All right, everyone, welcome back. We're back with Dr. Susan Phillip. Thanks for joining us again, Dr. Phillip. We've been continuing to stream on our Facebook and Instagram. Just quickly, for those who missed it, we were talking about if you see someone on the street who may be a homeless person who's coughing, is there a way you can help them? And you were just sort of finishing up that answer there.
Yes, and so they are a priority population for services and for prevention. And what you can do is, if you notice someone who is unsheltered and who looks like they may need assistance, call 311 and report it there. And we will make sure that someone from our emergency operations center is able to follow up and assist.
All right, we're getting another question now from Facebook, from Jill, asking us, how does this compare to SARS?
So that is a very good question. SARS is also a coronavirus, so they're in the same family of viruses. SARS was a much more deadly virus. Many more people died if they contracted it. However, it wasn't as easily spread. So this coronavirus, this COVID-19 disease, this infection we're seeing now, is much easier to spread person to person than SARS was. But people who became infected with SARS were much more likely to have very serious infections or to die. That's a great question.
I want to ask you something that I know some of my network of friends and family have been talking about, and that is this idea of false negatives in tests. The Wall Street Journal had a report that potentially 1 in 3 tests is a false negative. What do you know about that, and how concerning is this for you?
Yeah, we're learning more and more about the testing as we do more of it. And I have seen those reports as well. I think the reports that I've seen have said maybe 1 in 5. But, I think it likely could be a range. And I think that the tests we have may not be perfect. They're not 100% sensitive and 100% accurate, and very few tests are. So there is some degree to which we want to increase testing, and we need to have a clinical suspicion if people continue to have symptoms that are very suggestive of COVID-19, even with a negative test. So I agree that this is an area that we're going to have to pay close attention to and understand the limitations of the tests, and also await better tests that come out as more and more manufacturers develop tests for us.
You have friends of mine, a couple, one tested negative, one tested positive, yet they had the same symptoms at the exact same time. So it does make you question the accuracy of these tests.
Yes, and in that kind of a situation in public health, what we most likely recommend is that they both consider themselves positive and sort of treat themselves in the same way in terms of staying at home until their symptoms have fully resolved and their fever has gone away. So that's a great question too.
All right, let's talk about masks again. Julie's asking us, how long can you reuse a mask?
I think as long as the mask is dry and is not visibly dirty, you can use a mask for a very long time. I received one mask sort of as a result of working in the Emergency Operations Center, and I've been wearing it more or less for 2 weeks. I don't wear it in the rain. I use a scarf or some other cloth in the rain. But other than that, you can wear them for a long time. The point of the face covering is really to make sure that we are not spreading any of our droplets out without meaning to people. That is done in conjunction with staying 6 feet away and also trying to stay at home as much as we can.
All right, on Instagram, another question now. What happens if we hurt ourselves and we need to go to the hospital for any other reason? Is it safe right now?
And, if people are injured, if people are in motor vehicle collisions, I mean, this is part of the reason why we are working so hard to maintain capacity at our hospitals, and particularly, at Zuckerberg San Francisco General, which is our only level 1 trauma center in the city. So we do know that people might need to go into the hospital. At the hospitals, they are taking every precaution to make sure that they are both putting masks on patients as they come in, and the staff are also masked and wearing their PPE. So it is not a time to go in for elective surgeries or visits that are optional. This is not the time to go in for a routine visit. But if you need to go in because of a medical reason, please do go in and have confidence in our medical professionals.
All right, I think I'm told that maybe we're out of time. Is that right? Or we have time for another question? Okay, we're out of time. We'll get more during our break right now. So if you're sticking with us on our live stream, we'll keep these questions going. So many good ones coming in. Thank you, Dr. Susan Phillip, live with us right now. Coming up, I have a great conversation earlier today as well with the Santa Clara County Public Health Director, Sara Cody. We'll share that with you next. Stick with us and we'll keep our live stream going.
Thank you.
Okay, so we are still going. So thanks for playing with us here. So I think we had a question from Instagram of someone who said, are there any options for people who don't have a car? We know in San Francisco, a lot of people don't have a car, but they need to get to a drive-through testing center.
Yes, the drive-through testing centers, we are trying to do our best to expand availability. We're trying to figure out how we can also have them be in some of the higher density areas so that they're not just drive-through, they're walk-up drive-through. So we are trying to do that. And I think that's an important consideration because we want people as much as possible. If they're having symptoms, we certainly don't want people taking public transportation. So look for more options that will allow people who do not drive and may need assistance to come in. If you are having symptoms and you don't have access to testing, speak to your medical provider and they will be able to talk with us in the Department of Public Health. We have a consultation line for providers, and we can assist in trying to find routes of getting testing for someone who needs it.
All right, I know this is the question that probably everyone asks you, and I know everyone's asking me, and I'm asking myself, when do you see the shelter in place ending? Any sense of a timeline?
Well, as of now, we know that we have this immediate answer to that question is that we're going to continue now for several more weeks through the end of the month. And as of now, we are not thinking right now about further extensions. But again, it will really depend on what we see. And I think it's what we've heard Dr. Fauci say at the national level. We are not deciding this. The virus is deciding this. And what we can do is try and decrease the rate of transmission and spread.
Dr. Phillip, I got to say goodbye. We're out of time. This was so great. I hope you join us again. We really appreciate your time. Thank you so much, and thanks for all the work you're doing. Thank you. All right, welcome back. Santa Clara County Public Health Director Sara Cody. She was the first to sound the alarm about the outbreak of the coronavirus. She's been seen by some as the Dr. Fauci of the Bay Area. Today, I talked to her about the growing pandemic and how her early action may have slowed the spread of COVID-19 here in the Bay Area. It was a fascinating conversation. Take a listen. Dr. Cody, I want to start big picture with you. We're now entering our 4th week sheltering in place here in the Bay Area. Why is a surge still expected to come if we've been sheltering in place for this long now?
So we have to remember that everyone in our community is likely susceptible. In other words, if exposed to the virus, would become infected. And so when we have conditions like this, we expect a surge. What our shelter-in-place order does, though, is slow things down so that we spread the cases out over a longer period of time, and we spread the number of people who are severely ill and require hospitalization out over a longer period of time as well.
Does that mean that you expect almost everybody at some point is going to be infected?
Well, yes, probably at some point. Of course, what we're waiting for, but it's quite a long ways off, is a vaccine. And so absent a vaccine and absent a treatment, what we're using are called NPIs, or non-pharmaceutical interventions. And our best tool right now is this shelter-in-place order.
You've been given some well-deserved praise for being one of the first to ring the alarm about this pandemic. The Bay Area was thus the first in the country to enact these shelter-in-place orders at your urging. Do you think that this is why we aren't seeing as many cases as in other hotspots here in the Bay Area? Is it a sign that we're beginning to flatten the curve?
Well, while we're not out of the woods, I am cautiously optimistic that we've put our hospitals and healthcare partners in a better position to manage the infections that we expect will continue to be coming. What I will say is that, taking action early gave us an advantage in slowing things down. It has, of course, caused enormous social and economic disruption. But had we taken the actions later, we would still be sheltering in place. We would still be experiencing incredible social and economic disruption. And we would be having incredible strain on our healthcare system as well.
And you got the call on January 31st about the first case of coronavirus in the Bay Area in your county, Santa Clara County. At that point, did you expect that we would be where we are today with more than 1,200 cases in your county? Did you expect more, less?
What I can tell you is that in January, late January and early February, the experience we were having was like being in a dark theater. And so we just had one little sign, one traveler and then 2 travelers returned with this infection. But we didn't have the tools in place to allow us to understand whether there was spread in the community, and if so, to what degree. The pattern of this epidemic is becoming more clear every day, but it is still not completely clear. And that's because we still don't have widespread testing.
On that front, you were sort of raising the alarm in the beginning of this year. Do you think the federal government waited too long to respond?
Well, I prefer to focus on what we're able to do here in our county, in the county of Santa Clara, in collaboration with our partners and our colleagues across the Bay Area. And I think that we've been able to make a difference working together. I won't lie, there have been incredible challenges, and many of those have to do with a different level of preparedness by some of our partners.
On a personal note, you and your family live in this community as well and are also just as impacted as everybody else. Personally, what keeps you up at night right now?
Well, there's a lot that keeps me up at night, but I think that for me and for everyone living here, I just have to keep reminding myself that this is a marathon, and we have to keep ourselves nourished somehow, and we have to keep our energy good because we're going to be at this for a very, very long time.
When you say that, a very, very long time, what is your timeline? When do you think we might start to get back to some kind of normal?
The honest truth is I don't know, but looking at patterns in other places in the world, the pattern seems to be that when the community lets up on social distancing, for example, cases tend to resurge. And that's not surprising, right? Because we still don't have widespread immunity in the population. So we have to think about all the different ways in which we can limit spread and keep the rate of growth as slow as possible.
Just to go into that a little more, though, I think people are going to watch this and think you're saying almost everybody is probably at some point going to get infected. We're going to be in this for a very, very long time. I mean, are we talking a year? When are people going to feel safe to be able to mingle and mix with others again?
Well, I think we're still adjusting to our new normal. You know, life right now is very, very, very different than it was at the end of 2019. And part of our new normal and our new life is living with a lot of uncertainty. We just don't have certainty about what things are going to look like, a month down the line or 3 months down the line or 6 months down the line. There's uncertainty. We don't know.
Why is Santa Clara County at this point not releasing where the cases are within the county so that people can then try to avoid those certain areas?
So we want to be offering to the public and everyone as much information as we have. We also want to make sure that we're offering information in a way that's useful. So we will have information out very soon on geography. But I want to say, and this is really important, what we know now from all the signals that we see is that this coronavirus is very widespread in the county of Santa Clara. It's everywhere. And so even if you live in a city and you see, well, there's not very many cases in my city, that doesn't mean anything as far as the protective actions that you need to be taking.
If your own kids said, Mom, when do I get to go back to school? Would you reassure them that maybe come fall, they'd be able to start up at school again?
Mostly what I'm trying to do in my own home is try to get my kids used to online learning. They're not a big fan of it, but that's the reality at the moment. So that's where we're focused.
So you're saying that there's a chance maybe fall is we don't go back to school?
I just sort of want to go back to our new normal is that everything is uncertain.
Got it.
Yeah.
All right, we're almost at the end of our interview. I know there's a couple things that you want to talk about today, the unhoused population as well as discrimination in our communities. I'll give you a chance to talk about those important issues.
Thank you. So COVID-19, as with any infectious disease, tends to find populations that are more vulnerable. And anytime you have an infection that's really easily spread from person to person, of course, it will spread more easily in conditions where there's more crowding. And those are we're particularly concerned about areas in our county, communities where people are living in crowded homes. And if you think about it, if you have folks living together in a crowded home, it's extraordinarily difficult to practice consistent social distancing. And if someone in that home becomes ill, it's really hard to self-isolate away from others in a home that's crowded. So one of our bodies of work right now is to try to understand as best we can how we can help and how we can make sure that COVID-19 does not spread quickly in communities like that.
Very important issues. I thank you so much for all the work you're doing. Thank you, and I appreciate your time. Thanks, Dr. Cody.
Thank you so much.
All right, so that was our one-on-one interview with Dr. Cody, who is sort of the Dr. Fauci of the Bay Area. We can feel really proud that she and so many of our other health officials raised the alarm early, and the Bay Area was the first region in the country to enact these shelter-in-place orders. And as you heard her say there, Dr. Cody says taking action early gives us an advantage. It gave us an advantage in slowing things down. So there was a point, right, when we were seeing the same number of cases in the New York area and the Bay Area, and we've seen what's happened in New York. So far, the Bay Area hasn't gotten there yet. So it was good to hear from her on that front and many other fronts, sort of a grim forecast there. We're going to take a break right now for those of you watching us on air. When we come back, Dr. Alok Patel breaks down the new FDA-approved test. And we won't go away, though, on our live stream, including Facebook Live right now. So the show continues right now there. All right, guys, welcome back. I just popped into our Facebook, if you're watching us on Facebook, and said a little bit of a hello to you guys. We don't have anyone to ask questions for right now, but I see all your questions from so many of you, so keep them coming, and we'll try to get them answered maybe tomorrow or other days as well as we continue to talk to our experts. I want to show you the map here so far that we have showing all the cases in the Bay Area. Total cases are 3,747 right now in the Bay Area. That is up 55 from yesterday. The number of deaths rose by 2 to 92. And once again, Santa Clara County has the most cases and deaths with 1,200 cases there in the Bay Area, 1,207 cases, excuse me, and 39 deaths respectively. So that is what we're seeing there. Throughout the Bay Area. But again, this is less than maybe we would have seen had we not gotten on the shelter in place as early as we did. So that is something to be proud of, but we can't really end it yet. I mean, as we said, we asked Dr. Cody about it. There's still a surge that's expected to come. And I know my own family and friends have said, how is there a surge still coming if we've been in shelter in place for this long? Wouldn't we have gotten sick already had, you know, if we were going to get sick? And the experts are all telling us that, you know, it's a few factors. One, we're going to see more cases because it has taken a while to get all these tests done. But two, coronavirus is still out there, and we're all still going to the grocery store, and we're all still, you know, interacting with folks in different ways. And so it still is spreading. It still is alive and well. And so we have to keep doing what we're doing. It was kind of a grim forecast there from Dr. Cody saying it's going to be a very, very long time, quote from her, very, very long time till we get back to normal. But again, I know we're all saying it. We're all on it together, and we will get through it together. All right, I think we're about to come on air on TV right now. So that's enough of my rambling for the moment. Stick with us. Hold on. All right, welcome back. We are now able to bring you even more content now that we have this new platform at 3 o'clock every day here on ABC7. And that means we get more from our special correspondent, Dr. Alok Patel. Here is part of our coronavirus team of experts. And every day he's talking directly to you about a hot topic. And this one today could be a game changer.
On today's COVID-19 Doctor's Note, we're going to talk about the newly approved coronavirus antibody test, the serology test. Last week, the FDA granted emergency use authorization for a new blood test that looks for antibodies against SARS-CoV-2. Now, this test, made by the company Cellex, requires a drop of blood, takes about 15 to 20 minutes, and it looks for proteins your immune system would have made if you had COVID-19 in the past. The test is looking for two antibodies, IgM and IgG, but here's the catch. The test is looking for signs of a previous infection and may not be that reliable at detecting a recent one. Because in the early phases of an infection, your immune system needs time to make those antibodies. So if you get tested in this early phase, you could get a false negative. On the other hand, the test looking for viral genetic material, the nose and throat swab one, is fairly reliable at detecting those recent infections. The antibody test will hopefully tell us who's been exposed in the past and who may have immunity. It'll also give us really important information at looking at how widespread this disease is among people who had it in the past and didn't have any symptoms or had mild symptoms and weren't tested. We'll start to learn more as the test rolls out to hotspot areas. And as we learn more, so will you. Stay tuned.
Really good information there from Dr. Patel. Crossing our fingers we can get that test soon, as well as the vaccine. Thank you so much for joining us here on this new experimental interactive show. We'll be here every day at 3 o'clock on air and on our live stream answering your questions. Facebook Live, YouTube Live, ABC7news.com, and on our app. World News Tonight is next. See you at 5. We're done? Oh.
We are done.
See you at 4. See you at 4 if you're on live streams.